Enrolling in Medicare is a breeze with these 3 simple steps. You'll be covered in no time. Hey there, folks, are you approaching your 65th birthday? Well, if you are, then you're in for a ride because today, we're diving into the world of Medicare enrollment. Welcome back to the channel, where we're breaking down the 3 essential steps you need to know to enroll in Medicare for the year 2024. Enrolling in Medicare for the first time can be a real head-scratcher. The rules, the options, the deadlines, it's enough to make anyone's head spin. But fear not, because by the end of this video, you'll have a clear roadmap to navigate through the enrollment process with ease. Step number 1. Understanding eligibility requirements. We'll walk you through who qualifies for Medicare and when you should apply to avoid any penalties. Step number 2. Choosing the right Medicare plan. We'll break down the different parts of Medicare, A, B, C, and D, so you can pick the plan that best fits your healthcare needs and budget. Step number 3. Enrolling through the correct channels. We'll guide you on how to sign up for Medicare, whether it's online, over the phone, or in person, ensuring a smooth and hassle-free enrollment process. Generally, you're first eligible to sign up for Part A and Part B starting 3 months before you turn 65 and ending 3 months after you turn 65. You get Medicare automatically if you start getting retirement or disability benefits from Social Security before you turn 65. Otherwise, you have to actively sign up through Social Security. Medicare Part A, hospital insurance, helps pay for inpatient care in a hospital or limited time at a skilled nursing facility following a hospital stay. Part A also pays for some home health care and hospice care. You can also sign up for Part B. Medicare Part B, medical insurance, helps pay for services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment, and some preventive services. You can buy Part C from private insurance companies. Medicare Advantage combines Parts A and B and sometimes offers prescription drug coverage. It can include additional benefits like dental, eye care, hearing, or wellness services. Part D, it helps pay for prescription drugs. It's only offered through private insurance companies. If you aren't receiving Social Security yet, you can apply for Medicare once you're eligible in one of 3 ways. Apply for Medicare online at the Social Security website. This is the fastest method. Call Social Security at 800-772-1213. TTY 800-325-0778. Contact your local Social Security office. The online application typically takes less than 10 minutes. Visiting a local Social Security office could mean waiting in a long line, and the Social Security Administration encourages people not to show up without an appointment. To wrap it all up, let's recap the 3 steps. Eligibility requirements, choosing the right plan, and enrolling through the correct channels. Remember, enrolling in Medicare is a significant step towards safeguarding your health and well-being in 2024. Before you go, don't forget to explore more informative videos on healthcare on our channel. And hey, we'd love to hear from you. Share your Medicare enrollment experiences in the comments below. Your insights could help others navigate this process more smoothly. Thanks for watching, and we'll catch you in the next one.